My name's George Matson-Phippard, and I'm the online learning lead at Epilepsy Action. So today I want to talk to you about how we can improve our information for children and young people through user involvement. So to do this, I'll quickly dip into some findings from Epilepsy12. I'll then talk about a recent project that I've led and an upcoming project where we're going to use a new exciting approach. We know that there is health information, patient information for children and young people out there. People like us produce it, other charities, you guys, the NHS. And then in Epilepsy12, we see that actually, it looks all right. About 80% are saying they do agree that they've received enough epilepsy information. However, when we start looking a bit more deeply into some of the findings, actually we say, I do not require any more information. That's only 30% there. But then the other ones, we see that there's needs around the causes of epilepsy, side effects of medication, guidance or what you can or can't do. I also think this table is really interesting because what didn't we ask people? What other topics are there out there that people want information on that we can't get from this data? And then the most telling table for me was this one, where we see that around 19% agree that the information they were given was hard to understand, a further 21% are unsure, and that's different to their parents and carers. So what this is suggesting to us is that we're not actually taking the views of young people into consideration when we're designing information for them. And that's what led to recommendation number 14, which is that when we are designing patient informational services, we need to take into account the views of young people, and we should also be reviewing that information from the perspective of the young person. So I guess from our point of view as a charity, the big question is, what can we be doing to help you do that? Because obviously as an individual nurse, there's no way in hell you can be doing this sort of activity. So we in Epilepsy Action need to be there working with you. So what can we do to meet key recommendation 14? First of all, I want to flag up as well, so we're talking about information. Well, what is patient information? Actually, it isn't just information about epilepsy. It could be, say, like skills, beliefs, or attitudes. And to demonstrate a bit what I mean, I could be a young person with epilepsy. I might know what I should or could do to manage my condition. That's very different to me feeling able, confident, motivated to do so. So our patient information should cover things like this. And that is to make sure that children and young people essentially end up having the best possible health outcomes. So what might our patient information include? It might be simple stuff about epilepsy, but it might be knowledge about your well-being, your mental health. It might be knowledge about navigating the healthcare system. It might be specific skills or techniques. It might be something to bolster your confidence or give you motivation, different attitudes. So patient information needs to cover all these different areas. So what is going to be best practice then for developing this, thinking about that kind of holistic view of what information is, what we're trying to do with it, and recommendation 14. So firstly, it's not just basic facts about epilepsy, it's everything, all the information they need to help young people and their families make good choices, maintain positive behaviours, feel more confident, and in the end get the best possible health outcomes. And to do this, the information's got to be engaging and easy to understand and in a format that appeals to the young people. So the only way that we can figure this out is through the participation of young people, and we're going to have to work together to resource this. So that's a quick overview of where we are now and where we kind of should be. So I want to move on to a topic, a project that I've been involved in, and this is producing our new resources for children. So this started off with our animations for kids. So these are 6 different animations that cover different topics. And that includes different types of seizure, including focal and absence, but also topics around how to take your medication, how to stay safe when you're doing different activities, and how to talk about your feelings. So these are all topics that young people and also nurses identified as important to cover. And then due to the success of these, we got further funding to turn these into free packs for children. So these have the animations on DVD, but they also have an activity book that takes you through different things about epilepsy. There's a storybook, you've got the stickers, you've got colouring pencils. And kind of my thinking behind this was that when that child receives the pack in the clinic, it should put a smile on the face. So it isn't just boring information that doesn't engage you at all. It's something to make that child feel good and supported. So we also have all of this stuff, well, a lot of this stuff online, so it can reach a far larger number of children and young people. So this is in our updated website, which is really nice and child-friendly, and it should work on any smartphone, so you can access it wherever you are. So to produce all of this, we involved our young information reviewers. So these are a group of volunteers that work with us on all of our information for children and young people. So at the beginning, we sent out child-friendly surveys. So that was looking at, you know, the content of the topics, but we were also diving into what medium that should be. So what would kids actually like? Do you want to see colouring books? Do you want to see something online? And that's how we came to the resources that we've got at the moment. And then at the end, they were extensively user tested with young people as well. So we sent it out and we got feedback, and that was incorporated into the final product. So we're really pleased with what we've got. I hope you agree they look really lovely. And this is also backed up by some of the results we've seen so far. So we have 1,300 packs in 20 clinics across the UK. We've got about 100,000 views on social media, which is fantastic. And we can also see through digital analytics that kids are actually engaging with this a lot better. So, for example, they're looking at nearly twice as many pages and they're spending nearly half again as much time on the page itself. So to me, this indicates they're engaging better with the resources. So hopefully that means that our user involvement has worked. Oh yes, so these are our family-friendly evaluation surveys. I've just picked out a couple. You can see somebody's drawn us a picture. But the important bit at the bottom as well is, you know, we've now got a 4-year-old epileptic daughter seems so much more at ease and happier about epilepsy, which is fabulous. And I've also been doing structured telephone interviews with nurses to get out, you know, how things have gone. And the reason I picked out this one is she's saying it's a truly wonderful resource and children's faces are amazed. So that's great for me because that was what I wanted. I want to give that pack to a child and them to feel really happy and supported and love it. So that's all good. And it has led to us getting further funding to now move on to doing patient support for young people. So this will be an online tool for young people, and it will be something to help them manage their epilepsy, and it will be free and accessible on a smartphone, because we kind of know these are the ways that people want to access information. And we know, like all of our self-management information that we provide as a charity, it's got to be up-to-date, evidence-based, peer-reviewed, it's got to cover relevant topics, and it's got to have tools and activities that are informed by research and behavioural science. You know, we're not just going to make it up. But what exactly is this thing going to be? So, normally, explain briefly the process we go through on design. So we start off with research, we then go on to a big load of design and development of the tool or the resource, whatever it is. We then test it, we then launch it so people actually start using it, and then we evaluate it. So we see that we have user involvement at these 3 different stages. So, you know, we might do surveys for young people at the beginning, we'll test with young people in the middle, and we do evaluation at the end. The problem with this is there's a big proportion of the process where we're not involving young people at all. So the risk is, for example, we might involve a number of engaged young people right at the beginning with initial surveys, but we don't have much time for really discussing with them or using other activities to really pull out why they're saying what they're saying or the details. And then we might, for example, in the middle testing thing, we might have the final product, we take that out, but if somebody actually did say, actually this isn't right for me, that's usually at the end of my project funding and I can't go back to the beginning and start again. So that's a big risk. And similarly, with evaluation, we usually get quite a low response rate, so a couple of people tell us it's great, but we're missing out on information, and often that information isn't shared. So for this project, we thought we'd do a slightly different approach. And this is because with young people, we feel like this is a group that's actually quite hard to engage. So we want to make sure that whatever we produce isn't just covering the right topics, but it's also doing it in a way that's really going to hook people in. So, in the private sector, in web design and development, but also increasingly in the NHS and charities, people are talking about a thing called design thinking. So, I don't want to go into too many details. Just, has anybody heard or used of design thinking at all? No, see, I know in Scotland, like some of the innovation centres are using it, and I've gone to a lot of talks by an organisation called Habitat who do this sort of approach in Leeds, who are hosted by the NHS. But the idea is you kind of essentially spend a long time at the beginning of the process doing different activities, a bit like the ones that Emma was describing, to really understand and empathise with your user group, and then use that with them to kind of really define what the questions are, what the issues are, what the needs are. And then you move away from those activities and start producing prototypes or mock-ups. So what you do is you come out with these ideas that you put in front of people and do it really quickly so they can say yes or no. And instead of going to like the full product, which would take forever, you can very quickly decide, you know, what's working and what isn't. And the reason that people use this approach is essentially it reduces your risk and complexity. So at the beginning of my young person's project, I'm not going to have a clue what this tool is going to look like, what format it's going to be in, what we're going to cover. But then through very quickly putting actual, you know, mock-ups and tests in front of people, figuring out what works and what doesn't, we'll be able to discard the bad ideas and get to the actual good ideas. And then through this process of essentially natural selection almost, we get to the final design at the end. And it's only then that we will then partner with a tech developer and make this idea become real. So you see we have user involvement throughout the whole process rather than just in those 3 stages that I said previously. So it's not just me that's talking about this and getting excited about it. This isn't a literature review by any means, but it's some articles that I found interesting about people using this specifically for designing health information or health services. So, what is this going to look like for this project? It's split up into 4 phases. Excuse my scrawlings, because I did this the other day. So phase 1, that is when we are going to be doing this initial stage of really trying to understand young people and their needs. So we're going to do this through having co-design workshops, and we'll use a number of different creative techniques, including some of the things that Emma was describing earlier. So you can use sketching, you can use metaphors, you can use photo diaries, to really kind of use different methods to understand what's going on for young people. And then as part of that process, we'll also start to really define, you know, what is the actual need, what is the actual thing we need to be addressing here. So then we'll then move on to phase 2. So then we'll take some of these ideas and some needs, and we will make quick prototypes and mock-ups. These might just be printouts, it might be something quickly made on a website, and put that thing in front of young people and get them to test it. So it's only at the end of phase 2 that we'll have a really clear specification of what this thing will be, what it will look like, what language we're using, and also what it's going to cover. And then in phase 3, that's when we're going to get a tech partner and somebody to make this into an actual real object. So this is quite unusual for us, like firstly because I'm going to be spending a long time in this initial research and design phase, and also we're going to have young people involved throughout all of that. But what I'm hoping is it means that the end product will really meet those young people's needs, and that will help us to get it out there because they'll actually want to use it and they'll be able to see the clear benefit. So challenges are going to be finding and maintaining engagement with young people. So we're going to have to do a lot of building on existing relationships and groups and thinking of different ways that we can do that. Finding good partners, so good people that have got their head around design thinking, and getting the products out there finally. So even with our children's resources, it's been difficult getting them out of the office, out to you guys, I think just because everybody's busy. But, I mean, I hope that by producing this thing, we're going to have a really good new tool that will definitely provide young people with the support they need to manage their condition and help all you guys get the best health outcomes. So that's that. Thank you.